Depression is a mood disorder characterized by persistent low mood. It is a disorder that affects millions worldwide. According to the World Health Association, 1 in 5 women and 2 in 10 men experience depression at least once in their lifetime. Depression does not discriminate. Men, women, and children of all ages can experience the disabling symptoms. The illness can be brought on quickly or gradually, displaying a wide range of symptoms. The ACS Healthcare Group has set out to investigate the ever-increasing prevalence of depression in young adults. To accomplish this, we are looking for participants aged 16 to 35 who have experienced depression at least once in their lifetime. Participants are eligible to receive $1,500 compensation for their participation in the ACS Healthcare Group's 2015 research study.
Depression is an affective disorder related to mood, and its diagnosis is fundamentally clinical as it is made on the basis of a careful clinical interview and mental status examination. In order to effectively diagnose and treat depression, the doctor must hear about specific symptoms of depression and may resort to the criteria in the DSM-4, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, which is generally considered the standard diagnostic approach. The DSM-IVTR criteria for diagnosing depression is shown in this slide and appears on your notes. The use of the DMS can be evaluated as follows. The main strengths of the manual are: it is internationally accepted and widely used in the world. Patients may feel slightly more comfortable after they can associate with symptoms they have experienced and the mental disorder. It can eliminate individual psychiatrist differences caused by subjective thoughts because they all follow the criteria for the certain mental disorder. On the other hand, the main limitations are: the criteria cannot be generalizable into some different cultures. It has been created from a Western perspective and cannot therefore adapt as well to other ethnicities. It has a problem with false positive diagnosis or false negative diagnosis. Once diagnosed to have a mental disorder, one is labeled that one has the mental disorder for their whole life. The use of the DSM-4 is limited and also has a number of disadvantages when it comes to diagnosing disorders such as depression. This is because at times it may be difficult to determine whether any particular symptom is caused by depression or by another medical disorder. Also, a depression diagnosis is often difficult to make because clinical depression can manifest in so many different ways. The system itself produces an excessive fragmentation of the clinical stages of 6 mental disorders. This is the reason why many patients are given many different diagnoses simultaneously, once the symptoms overpass the rigid borders of the manual proposes. And finally, observable or behavioral symptoms of clinical depression also may sometimes be minimal, despite a person experiencing profound inner turmoil. Depression can be an all-encompassing disorder, and it affects a person's body, feelings, thoughts, and behaviors in varying ways. Because the diagnosis is based on the symptoms as patient presents, it may be appropriate to consider other psychiatric disorders such as obsessive-compulsive disorder, panic disorder, bulimia nervosa, and dementia, general medical conditions, medications, a substance use disorder as etiologic, and to pursue relevant diagnostic investigations.
Depression is a hard disorder to treat because scientists and psychologists are still not completely sure for why and how it strikes. Also because some treatments work for some people better than others, and vice versa. Also, therapy and drugs sometimes work and sometimes they don't. All these points make depression a very hard disorder to treat. The 2 main types of treatments used to treat depression are antidepressants such as selective serotonin reuptake inhibitors or SSRIs, and therapy such as cognitive behavioral therapy or CBT. SSRIs are some of the most common biomedical treatments used as antidepressants to treat depression. They are usually the first choice medication for depression, as they generally have fewer side effects than most other types of antidepressants. They primarily work on brain chemicals called neurotransmitters, or serotonin. Scientists have found that serotonin is involved in regulating mood. However, they're not yet sure how exactly they work. Although it is too simplistic to say that depression is caused by low levels of serotonin, research shows that an increase in serotonin levels can improve the symptoms and make people more responsive to other types of treatments, such as CBT. When prescribing SSRIs, doctors will usually select the lowest possible dose thought necessary to improve your symptoms in order to reduce the risk of possible side effects. This dosage is taken for 2 or 4 weeks before the benefit can be felt. If the initial dose has been taken for 4 to 6 weeks without feeling any benefit and it proves ineffective, it is usually gradually increased. They are usually in tablet form, and depending on the severity of the depression and the type of SSRI, the common dosage is from 1 to 3 tablets a day. A course of treatment lasts about 6 months most of the time. However, longer courses are sometimes recommended for some people, and in rare cases, people will be advised to take them indefinitely. Overall, SSRIs are the most tolerated over other types of antidepressants. Majority of users will experience only a few mild side effects when taking them. Even if experiencing side effects, the medication should not be stopped as it takes several weeks to notice the benefit, and over time the benefit will outweigh the side effects. CBT is based on the assumption that a person's mood is directly related to the patterns of thought. Researchers believe that negative and dysfunctional thinking can affect a person's mood and sense of self, behavior, as well as the physical state. The goal of CBT is to help a person learn to recognize their negative thoughts and to learn to evaluate their validity, replacing them with healthier ways of thinking. CBT practitioners and researchers believe that when thought patterns and behavior are changed, so is mood, and therefore they work on changing negative thought patterns. CBT focuses on immediate present, in what and how a person thinks more than why they think that way. Therapists help patients to monitor and write down negative thoughts and mental images in order for them to recognize how those ideas affect their mood, behavior, and physical condition. This teaches important coping skills like problem solving. Patients are expected to take an active role in the sessions as well as between the sessions. They are given homework assignments that are reviewed at the start of each session. CBT has a goal of terminating therapy at a certain point, which is usually about 14 to 6 weeks into therapy. It takes about 8 weeks for patients to become able to use their skills that they are learning in therapy. During these 8 weeks, the patient usually experiences a significant reduction of symptoms. In between weeks 8 to 12, the patient often experiences remission symptoms. The remaining time of therapy is spent practicing learned skills and preparing for issues related to the ending of the sessions. More severe cases may take longer than 16 weeks.
Joshua is a 28-year-old married male. He has a very demanding, high-stress job as a second-year medical resident in a large hospital. Joshua has always been a high achiever. He graduated with top honors in both college and medical school. He has very high standards for himself and can be very self-critical when he fails to meet them. Lately, he has struggled with significant feelings of worthlessness and shame due to his inability to perform as well as he always has in the past. For the past few weeks, Joshua has felt unusually fatigued and found it increasingly difficult to concentrate at work. His coworkers have noticed that he is often irritable and withdrawn, which is quite different from his typical upbeat and friendly disposition. He has called in sick on several occasions, which is completely unlike him. On those days, he stays in bed all day, watching TV or sleeping. At home, Joshua's wife has noticed changes as well. He's shown little interest in sex and has difficulty sleeping at night. His insomnia has been keeping her awake as he tosses and turns for an hour or two after they go to bed. She's noticed him increase his drinking habits over the last few weeks, which have her worried. When she tries to get him to open up about what's bothering him, he pushes her away with an abrupt "everything's fine." Joshua has found himself increasingly dissatisfied with his life, and occasionally has even considered suicide, and has frequent thoughts of wishing he was dead. He gets frustrated with himself because he doesn't think he should be having these feelings, yet can't seem to get over the sense of doom that has been feeling more and more lately.